We nice to have this meeting to order. This is the regular business meeting. Appreciate all of your patience for letting us finish our executive session. And with that, can we call roll again so I can stay here? Sure. Okay.
So Matt Lockheed.
Present.
Rochelle Woods.
Present.
Sarah Lampy. Sherry John.
Here.
And for the record, Harriet Hall is absent. A quorum has been established.
Okay. The first order of business, first of all, we have language justice folks with us. It is going to be Alejandro or Crystal, and I'm not sure which. So whichever one of you jump in, just tell us who you are.
Hello, thank you very much. My name is Alejandro. I am here with Crystal. We will be the Spanish interpreters in this space, so I'm going to go ahead and provide some instructions for our folks in Zoom, so thank you for your patience. Hola a todos, gracias por tenernos aquí con ustedes. Mi nombre es Alejandro Arrieta y estoy aquí con mi colega Cristal. Vamos a ser sus dos intérpretes del español. El día de hoy, si usted se encuentra presente en esta reunión por medio de Zoom, en un momento vamos a aprender la configuración de la interpretación y en ese momento verán un globo terráqueo en la parte inferior a mano derecha de su pantalla. Si no lo ven ahí, verán bajo el menú con los tres puntitos que dice más la opción de la interpretación. Pueden escoger el español y favor de avisarnos si hay algún problema con la interpretación. Pero con eso ya vamos a aprender la interpretación para comenzar. Muchas gracias. And with that, I will pass it back over to you all. Thank you very much.
Alejandro, thank you so much. And we always appreciate it when you all can come. So thank you for being here. Okay, we have a consent agenda. Has everyone had a chance to look at the items? Are there any questions or is there a need to move any of those off for further discussion? I think we've pretty well gone over them. And if it's up to the board's wish, I could take a motion to approve the consent agenda.
I would move to approve that. I'll second.
It has been moved and there has been a second. All those in favor, please say aye.
Aye.
Aye. Any opposed? Hearing none, consent agenda is approved. Public comments. Lindsay, do we have anyone?
I am aware of.
Speak to us. Hey. As always, we appreciate public comment. We don't have a back and forth dialogue, but we'd like it when people, if they have comments or questions to come forward and to present that to the board, and then we can do follow-up at another time. New business. Ooh, we're already fiscal 2027. All right. You are on. I'm assuming it's the three of you.
I mean,
Yes.
real dream team.
Okay.
Yeah.
This is going to be a big one.
Well, it won't be long.
Won't be long.
Yeah.
So good afternoon, everyone. Members of the board, staff members, everyone in attendance, good afternoon. Today, we're going to be presenting the proposed 2027 JCPH budget for your review, for your consideration. Before jumping into details for this budget, I wanted to mention that this budget was designed in support of our mission while maintaining our commitment to fiscal stewardship, our operational sustainability, and of course, the evolving needs of our community. So there's a lot that went into this, a lot of the different efforts that we wanted to make sure that we were addressing this budget, that we encapsulated a lot of what we anticipate for our future as we move forward. While developing this budget, we focused on balancing the available resources that we had around our strategic priorities, and of course, making sure that our staff were supported throughout this process, that we have placeholders, that we have that investment behind our staff members. Also, in preparation for this board, we wanted to prepare for the Daylight Collective transition. There's a lot that we have planned. And also our staff, a lot of credit to our staff for exploring a lot of those opportunities around different funding sources. There's been a lot of influx with funding, with grants, so a lot of effort went into this budget. Overall, I will say that this proposed budget reflects our efforts to ensure that we're mending that sustainability, that we are presenting a budget that really shows that long-term commitment to public health in general. And also exploring new opportunities. There's a lot of growth, there's a lot of change, there's a lot that we're prepared for. So there's a lot that's being built in it. Here during the executive summary, we have a lot of broad highlights. I won't get into a lot of the details. I won't get into much of these details, but I do want to emphasize that there is some significant growth within this budget, and you'll see that once Salma has an opportunity to see. There's growth in almost every aspect of our budget. Everything seems to be increasing in the right ways. We are really moving in the right direction and preparing for a lot for next year. Before moving on, I did want to focus on one bullet, that is the third bullet, and that is the general fund transfer. Not so much the amount, but the description. We've been using many terms to describe that supplemental funding, county transfer, general fund, taxpayer. There's a lot of terms. We really want to emphasize the focus of general fund, because as we look at county transfer, I think that omits the fact that JCPH is no longer the siloed agency within this government, within this agency. We are part of the county, so we want to make sure that we are emphasizing that as we move forward. We're in this building. We are the county. We are where we need to be. We are within the community. We're part of everything. So really focusing on, as we move forward, that key phrase that is the general fund transfer. In this next slide, I really just want to emphasize how busy our staff members have been. There's been a lot going on. We've been focusing on program investments, growth. The importance of today's discussion really is that funding opportunity and everything that we're seeing that is contributing to our sustainability. So with that, I'd like to turn it over to Salma to start digging into some details.
Thank you, Joe. So this slide here just sort of shows an overall picture of our total budget for the last 5 years, especially with our 2023 and 2024 revenues. I do want to highlight that those figures were heavily impacted by COVID dollars. And 2025 budget was around 22 million. So that's where we were approximately prior to COVID. Our 2019, 2018, our budget was between 21 and 22 million with a slight increase to cover merit adjustment and merit cost. However, the last 2 years, or I should say 2026 and 2027, we are noticing a significant increase, not only to cover the merit adjustments, but also shows investment in our programs and our staffing as well. So definitely expanding clinical services expansion is reflected on our programs as well. Next slide shows where we at or overall picture of our revenue sources. The yellow one is the general transfer funds. Notice here that although we are requesting $400,000 extra of general funds, we are less reliant on general dollars than prior years. So we went from 52% to 47%, and then we're increasing our grant revenues from 35% to 40%. So that speaks volume about like our staff efforts to receive additional grant funding. We're also seeing an increase in charges for services due to clinical services expansion, including vasectomy program and sexual health. And then on the following slide shows just the trend over time also of the revenues. One thing to highlight here is really charges for services and how it's increasing or projecting to increase from 2026 to 2027 by approximately $700,000. And again, those revenues at the beginning of 2023 and 2024, they were influenced by COVID dollars. So we're definitely increasing our grant revenues comparing to 2019 and prior. And then this last one here for me is the expenditures breakdown. Our largest asset is really people. to provide services. So 75% of our budget is attributed to salaries and benefits. And then 10% of the budget goes to county supporting activities, and that's legal fees, IT infrastructure, and administrative support that they indirectly provide behind the scene. And the remaining 14% is attributed to other operating expenditures, with the majority of it going to contractual services that are tied to grant-related activities. I'm gonna turn it to you.
Great job.
Thank you.
Thank you. So I'm gonna talk about when we put this budget together, what we decided to include. And what, we kind of call these our strategic investments. The process, for your knowledge as well as for staff who are listening, is that division directors, program leads meet directly with Salma and her staff and really lay out their case for this is what we need for next year. Those requests come to me and I confer with Christine, with Kelly, with Joe, with all the folks who advise me to say these are the priorities. We try to include as much as possible within the bounds of what's realistic. But our major, I would say our major philosophy this year was like, let's just keep it very simple, very straightforward. Because we're moving locations with the clinic and WIC, we didn't think it was a good time to say, let's go big or go home, right? Like, let's spend big. We're really trying to maintain really responsible, bless you, stewardship around the funds that we have. So it isn't a huge ask. And by ask, when we say decision package, we really just mean, can we have some extra money, please, from the general fund or other funds that have been identified? And we'll see what happens. But this is the budget as it stands now, what we think is an appropriate amount of money to spend next year and where we want to spend it. I'm just going to highlight a couple of the major differences between this year and next year. So community health partnerships is our biggest mover, let's say, and you've heard a lot about this team, and Alex has been sharing a lot about our awarding of the ECC contract. But with that new responsibility, really does come new costs associated with doing that work, even though it's paid work. I do want to say that part of the increase in grants has been really fascinating because we pulled back on grants. We really were like, we want more sustainable funding. We're going to really go for more, local taxpayer revenue and try to kind of finagle our way into that pot more. And we did. And then the payoff to that was that we actually got more grant funding, and that grant funding is more sustainable, bigger, longer term, and not federal. So that was that wasn't, I won't say it was super calculated, but I do think it's worth pointing out that when staff can breathe a little and not worry about where their next paycheck's coming from and not worry that, this grant's going to run out tick-tock because the federal administration made a decision and everything can go away overnight. We learned that with the COVID ELC dollars that we had to scramble to cover. Now we have, funding pass through, yes, but state funding to run the ECC. We got a grant thanks to the amazing leadership in environmental health, $250,000 from Kaiser Permanente. Like that could go on a really long time. Settlement dollars, the Jewel settlement dollars are supporting moving to Daylight Collective. The opioid settlement dollars are going to the majority of the increases you're seeing in the clinic. So these are things that are multi-year, high dollar investments that are going to pay off with other more sustainable funding. So I just wanted to point that out. It's not grants that make me nervous or keep me up at night where I think, oh gosh, what about when this disappears? I really do believe these are catalyst opportunities. So I'm excited about that. And normally I wouldn't say that about grants, but I am quite excited about it. So you'll notice that community health partnerships, though they're bringing in, and a lot of their grant funding is also around our universal home visiting program with Family Connects. So there will be an additional transfer request for community health partnerships. And I'll talk a little bit in a minute about how we're packaging our decision package. a little differently, not by program, but for pay equity. So their expenditures have increased, but it's really supporting like leadership positions within, because now it's like the coordination required to not only do early childhood excellence, but referrals to WIC, referrals from WIC to Family Connects and back again, all the way to sexual health. So you see that, when we're thinking about birth control access and WIC, and we're thinking about universal home visiting and daycares and preschools, wow, that's a lot. And it's going to take some really high level leadership. And Alex is amazing and brilliant, but she's going to need support from a strategic perspective too. So I think this is a worthwhile investment in this team. And they've also shown they're just really good at getting funding and really good at getting opportunities, and they're very innovative. So that is the majority of the additional funds that we would be requesting. And then on the other hand, you have clinical services whose revenue growth is outpacing their expenditure growth. We don't expect that to last forever, but it does mean that we can kind of balance the scales a little bit, pull back a little bit, because county local taxpayer funding definitely came through in the clutch with clinical vulnerabilities with this new, or with the, I guess we're halfway through, with this administration federally. So this has allowed us to protect our teams a little bit stronger. And so we are asking for a little less general fund support, because also our harm reduction team with Points West has done a fantastic job of bringing in our opioid settlement funds to be able to expand the program. And as of next Monday, likely expanding that into partnerships with Gilpin and Clear Creek County. So not only are their services expanding, but our geographic reach to help people as well. So it seems that the more we invest in clinic to give them the room to plan, the more revenue they end up bringing in. And we find that to be a pattern and one that we hope continues into our move into daylight in first quarter of next year. And then lastly, when we talk about strategic investments, I want to talk a little bit about some of the other random things that are in the budget. We are still going to maintain a very healthy budget for professional development opportunities. We've been able to have a very, I would say, worthwhile investment in our contract with Kim Boyd and her team to be able to pour into everybody, not just people managers, but individual contributors. So we'd like to keep lifting up the strengths work. We're definitely seeing improvements across the entire department. There are many teams that are requesting some software modernization, so and infrastructure. So we put a line item in for that. Both emergency preparedness and disease surveillance are asterisked on the presentation because those have been deemed eligible for a 1A designation, which means that they're public safety. So though that's not like general fund, that is still part of retained revenue that we passed with the ballot measure 1A. And so it's pretty obvious what the case would be, that preparing for big emergencies and tracking diseases is pretty core public safety work. So, and that's about $500,000 of requested retained revenue for those two teams. And then last thing I want to say on this slide is that as it stands now in our negotiations with the budget office, they have budgeted 2% from the general fund to the public health fund for salary adjustments for cost of living, although they are recommending, and other departments are getting 4%. Their justification is that we brought in more revenue, and so therefore we need less general funds. Our justification is that we would like to maintain equity with other departments. For the last few years, they have transferred over the entire salary adjustment and not 51%, which is what they're transferring now. So when we go in front of the Board of County Commissioners for our decision package to simplify, we're going to ask for the remaining 2% so that we can be at parity with our other sister and brother agencies and still maintain the investments in these. I think it's like net 3 positions, not including the ECC hires. So the hires that Alex has to do for the Early Childhood Council are separate, but on top of that, we're looking at just a few net new FTEs. So it's not huge, outside of grant funding, so general fund funded FTEs. So I don't think it's actually going to make a huge impact when we get up there and say, hi, we would just like this money to do what everyone else is doing, as opposed to packaging it in a story of early life investments and clinical care and quality improvement. And I think it would just be simpler to say we would also like that money. So we'll see how that turns out. But that is, regardless of how we package it, the decision package itself is like $500,000, $350,000 to $500,000. So that's a lot less than we've asked for in the past. I think last year our decision packages, including retained revenue, equaled what, $2 million or something like that. So we're keeping it a lot smaller this year, thanks to staff. And on that note, there is the net impact is $411,000 is the difference in general fund transfer between last year and the upcoming, or this year and the upcoming year. So that's what we will be packaging. That does not include the retained revenue for public safety. That's a separate request process. So that's where we're standing at right now. And Joe is gonna finish it for us.
Yeah.
And then we'll all be open to questions.
I think
Yeah.
you've also kind of
I teed you up.
beat me up, but you also covered some of the pieces.
Oh, sorry.
With the review process and with the approval process of some of the budget requests aligns with really the development of it. And I think every year I try to make a point to give as much credit as possible to the staff, not only the finance team, the budget team, but of all of our program staff members who take time out of their effort, their long days, their efforts to increase their impact within their programs, but to set aside time for this administrative task, this very important administrative task, but sometimes very tedious task. It is an uphill battle, and I've not seen it so much a moving target as I have this year. There's been so many variables, so many funding influxes, so many change, both brick and mortar, both moving, coming and going, vans, wraps on vans, and everything that in between. So this has been an uphill battle. A lot of credit to Salma and her team, who have put all those moving parts together into something that board can absorb, can stand behind, hopefully be proud of, but also huge congratulations, a huge amount of support went into this, and I can't tell you how much we should all appreciate our staff's commitment to this. So definitely a lot. Thank you. And with that, Alma slide.
Questions. Before we get to questions, as a reminder of the timeline, so this is kind of a more casual presentation. The budget is about this big and about 400 spreadsheets. There's really no easy way to give it to you because it all happens kind of a work day. So Salma went ahead and made this very cool budget snapshot. Looks like Halloween. And so summer colors, I guess. So this is just a starting place, but we are all available to, if you want to dig in a little more on line items or details of the budget. We are here for the next 30 days to meet with you before the virtual July meeting where the budget needs to be voted on. So again, it's so many nooks and crannies of a budget that we're always happy to sit down with you and that spreadsheet and say, what do you want to see? It's just trying to put it in a consumable manner is a little difficult. So, but just wanted to let you know about those details. That's it. What would you like to know?
I like it. I think it sounds great.
I have a question. So when you're talking about, they want to just give us the 2% because y'all did such a great job.
Yeah.
Brought in all this money. That money that was brought in really is for specific things.
Right.
And that's really that should be not even on their table.
Yeah, I mean, we are gonna discuss that with them for presentations. That's just the way it stands now. It's pretty, I would say, standard practice, but the thing about public health that makes us different is that we have a very large source of revenue that isn't fees or charges for service, which come with expectations, indirect that we have to take off of it. Plus, some of these grants we wrote 2 years ago, we didn't know what the recommended salary increases were gonna be or what the cost of living adjustments would be with Social Security Administration, which is what we kind of pegged our increases this year to the actual cost of living adjustments. So like it's all kind of new territory. So I can definitely have some empathy for like, let's just throw out 2% and see what happens, or 51%, which is a 2% salary increase. And we'll, push back a little bit, but I get it. It's just that we don't have flexibility with the largest increase. We don't have flexibility. Now, for some of the grants where we were able to build in like kind of future proofing against salary increases, we could go back and amend, but that's not gonna hit us until after 27. So it's just kind of an interesting like lag that we're really hoping it's gonna be small enough that it will just.
Plus, the health
Yeah.
department's taken on more than they ever have.
Yeah. There's always more work to do. So that's the interesting thing too with the revenue pie charts. Like the pie is bigger. Like the pie has gotten bigger. The work, it will never be done. I mean, so if someone gave me a gift of here's $1 billion, like I couldn't even possibly do all the work there is to be done to protect people from getting sick, right? Like that's the job. And so that's also something we have to discuss because it also is we're a very different industry, I guess, because there's so many things we could do that we don't do. And that's not always the way it is for government agencies that have a very strict mandate for services that they have to deliver. We have a lot more of an open horizon with what's possible. And so we have to stand up and make the case that just because we bring in more money doesn't mean we want to give back the money that was allotted to us. It means we owe you an explanation of what we're going to do with that money, which is exactly what we did with Daylight. We had leftover money. We went to the BCC and said, please let us keep this money so that we can build this really amazing clinic to do this work. They all said, great. And now we get to build the clinic. So that's an example, like that's our responsibility to report back, but that's where we're sitting right now.
It'll be the current commissioners that vote on the actual budget.
Yes.
So it'll be before November.
No, it'll be before January when they're out.
Oh, yeah.
Yeah, so yes, so it'll be the current commissioners
My
now.
mind is like November. That's
Yeah,
just it.
I get it. They actually
Yeah.
vote, we present in August, I believe.
Believe so, and then it's either late November or, no, it's early November. Before
Early
August.
November,
Because it is done before the new
yes,
person
yes.
seats.
Well, 2 people,
Oh, yeah.
potentially. We'll see after this month whether that is going to be, we will potentially have 2 new commissioners. Yeah,
Leslie's
We'll
done.
know on
and
the
Brown's
30th.
done.
We'll know on the 30th.
we'll know on the 30th,
Whether there's 2.
right, 2
Oh,
spaces.
he's not termed, is he?
No.
That's
no.
right, that's right.
So we'll see soon.
Okay.
More questions?
You have a question. I have a couple questions about the budget, but I have a question about the general fund. Is that only tax dollars or does the indirects that we collect go into the general fund? They don't. They go into a different indirect fund for the county.
So that's only tax dollars that we get.
Okay, that's helpful.
Yeah, the indirect that we get from grant supports our overhead cost.
Supports your, okay. Okay. What is interdepartmental? Do we contract with other departments? to deliver?
Interdepartmental is the cost that we get charged by the county, which is the 10% I mentioned in my
Okay.
expenditure slide.
Okay.
For overhead, IT, and other legal services and so on.
Okay, that's what I assumed, but I also was like, wait, intergovernmental, but that would be between government agencies.
Yeah, yeah, I know,
It makes sense now that I'm saying it out
Right,
loud.
Sorry, there is interdepartmental, which is the cost allocation,
Yes.
and then intergovernmental, the payments to state that we pay for third and decision kits and the restaurant licensing.
Okay. Thank you. My other random question is. Part of this budget is a new medical director. Where are we in that search?
Oh, great.
I'm glad you brought that up.
The offer is done.
We're good.
We, yes, we made an offer, it was accepted, and start date is,
29,
but like,
but in a phase
training,
different approach.
yeah. So hitting the ground full on in
I
August.
hit my July.
Dr. Elise Terhar, formerly of, well, 2 jobs ago, Colorado Coalition for the Homeless, former ED physician, and currently in a different organization, but will be joining us, and we're very excited about that. So.
Will you be having a meet and greet of any
Oh,
kind?
yes, absolutely. I don't know what that looks like. Christine is in charge. And the medical director will report to the deputy director. So, but we'll be part of the executive leadership team as well. So we're over the moon. And we had the most difficult decision. I'll just say it was very hard. We had some really high caliber candidates, some of whom I am trying desperately to push onto either gubernatorial Democratic primary candidate as a potential for state leadership eventually, because we had some really amazing people who are local with national high profile, and it was tough. It was a tough one, but staff was very involved in that decision. We took every piece of feedback to heart on the hiring committee.
Thank you. I know slightly tangential to budget, but it's part of it.
It is a big part of it. Thank you. I mean, you can see too from the expenditures, that's the thing that is really important to me, is that we kind of maintain that the largest proportion of our expenditures is salary and benefits. Like, there isn't a lot of wiggle room. We talked about this with the really tough time we went through with our reductions in force. You see from that, like, upward trajectory after we had to make some really hard decisions. We have been able to bounce back and thrive and grow leaner, but also now filling out our staff with the roles that we need. And we're still learning, like, what is necessary in this era of public health and what isn't. And that stuff, you know.
Other questions?
I don't have questions, but thank you for always doing such a great job explaining the financials.
Yeah.
I'm not the financial person on the board here by any means, but I have great faith in you guys. I think that you guys are gonna just hit the ball right out of
Yeah.
the park, you know?
Thank you.
So I look forward to hearing what they say back. I've seen some amazing things from this team, you know, over the past few years. And I'm excited about what you're proposing because it just looks like the next phase of all the work, the hard work you all have been doing, coming to fruition. We just have this little last hurdle.
Yeah.
And I think our employees are just a huge value to all of this, and their contributions certainly do go noticed, right? We know this. So, and soon so will all the citizens of Jefferson County with our new center and services and just everything else. So kudos, guys. It's a great presentation to somebody who doesn't really understand that too much. So
Thank you. Thank you. And next year, and I've already discussed this with Salma, I really would like to start earlier, and I'd like to have a participatory aspect to our budget process where staff, but you know, aside from going through the regular channels of, oh, we need 2 more vans. I don't know what I just picked up. We need 2 more vans. That once all of the options for expansion are out there, people really can play around with what goes into prioritizing this, all of these. We can't say yes to everything. So how do you say no, and on what grounds? And I think that should be participatory, not just our staff, but external stakeholders as well. So, I mean, at the end of the day, I have to make a decision, but I would like more hands-on participation from folks. And then I have another staff member who brought me this very cool tool that she's playing around with, which is basically an equity analysis for a budget, so that you could like layer over something to just double check to make sure that those investments are really benefiting the folks who need it the most. And so there's just so much we can do to improve on that, because I mean, it's nice to see that upward trajectory, but you adjust for inflation, it's the same amount we got in 2022. So, it's like, look, incremental growth is better than no growth at all. I think that we have to stay safe for the next couple years, but not mediocre, so that's the balance. But thank you for your words. We designed these things for folks who don't have experience in like deep budget analysis like me, and getting that feedback is really helpful. So thank you.
Okay, thank you. Good presentation.
Great. And now,
And now
The
we
most
have
important
on the
thing.
agenda. Well, this must have really snuck in here. I'm telling you. Christine Billings has something that she has managed to get on here.
yeah, she really just shoves her way up.
Yielded.
Don't you know?
One, yeah.
You upper Midwest now.
They're like, are you from Minnesota? Yeah,
Yeah, Minnesota.
Minnesota. I lived there when I was. Perfect. For those online, this is Christine Billings. I'm the Deputy Director here at Jefferson County Public Health. And I have the distinct honor to celebrate one of our own upon the forthcoming retirement from his work in local public health. So Jim, if you could come join me.
I think he should come right up here.
There's a lot of celebration and a lot of words that I have had the privilege to read from colleagues across the state as we work to celebrate you next week. Just like Dr. Story, I'm going to channel my best and hold it together here. But ahead of that, we wanted to have you officially celebrate Jim's retirement with a Board of Health resolution. So if you are able to delegate to me, I'd like to read it. And then you can go ahead and sign it.
Well, I would love for you to read this.
Perfect.
Please proceed.
So, Jefferson County Board of Health resolution honoring and celebrating the career and retirement of James A. Rada. Whereas Jim Rada dedicated 45 years of distinguished service to environmental health, improving the safety, health, and well-being of communities through his leadership, expertise, and commitment to public service. And whereas Jim has served as the Environmental Health Services Division Director at Jefferson County Public Health since 2012, leading a team of professionals, advancing environmental health programs, and contributing significantly to agency-wide policy and strategic initiatives. And whereas throughout his career, Jim has championed public health ethics, workplace safety, health equity, environmental justice, climate change preparedness, water quality, and other critical environmental health priorities while developing innovative solutions to complex challenges. And whereas Jim has strengthened public and environmental health systems across Colorado through leadership roles at the local, regional, and state levels, including service on numerous advisory committees, commissions, and professional organizations. And whereas during his career serving communities in Colorado and Illinois, we won't leave them. Jim led efforts in consumer protection, wastewater management, water and air quality, epidemiological investigation, land use planning, hazardous materials response, and public communication, and provided steady leadership during the COVID-19 pandemic. And whereas Jim has been a trusted mentor, a collaborator, and an advocate for environmental health professions, shaping future leaders, advancing workforce development, and earning recognition, including the Colorado Environmental Health Association's Milton Miller Award and commendation from the Colorado State Board of Health. And whereas Jim's career reflects exceptional service, visionary leadership, and an enduring legacy that will continue to influence environmental and public health practice for years to come. Now, therefore, be it resolved that the Jefferson County Board of Health expresses its deepest appreciation to Jim for his extraordinary contributions to the health and safety of Jefferson County residents and to the field of environmental health. And be it further resolved that the board celebrates Jim's retirement, honors his distinguished career, and extends its warmest wishes for fulfillment and continued success in all future endeavors.
I am going to put my signature on it, but I would like to give the board an opportunity to jump in and weigh in, if you will, weigh in.
I already sent Jim a mushy little email telling him. Yeah, I let Jim know that I am so appreciative for his knowledge that he has shared with me since I've been here, especially in regard to environment. I talked to him several times about how nurses need to really recognize more some of the discussions we were having about how knowing environmental things like, rabies or, bats or, just whatever is going on in our community. But lots of conversations about climate change and how these things are more prevalent now and, keeping the community safe and just the list could go on. But when I saw his announcement that he was retiring, I was incredibly, I think I even told you that I was tearful as I was typing. So I think he's been just wonderful, wonderful.
Great thing. Wanted to thank you for, as the new person on the board, always, answering all my dumb questions.
No dumb questions.
Providing the expertise and, really explaining really complicated scientific things in a way that is understandable to people without a science background, me included in that. But also, even before I was, part of this board, all the work that you did to, provide for the safety and the health of this county. Thank you. A lot of it was taken for granted that we, live in a beautiful and healthy and safe place, and it's a part of you that was able to do that. So thank you.
So I'm mad at Jim. He's ruining my birthday, retiring on my birthday. So, just the downside of turning 45.
So I'm excited.
There you go. But not really, just kidding. I've known Jim, I think I've known you for 20 years, something.
You were with Calfo at least.
Since I was with Calfo, which was 20 years ago, before you were with Jefferson County. And so it's really not okay that I don't get to work with you on an ongoing basis. I know you'll be around. You're not going to go far. We won't let you in reality across the field. And it's I don't know. I don't really love being in a field where you're not there. So I am sad to see you go, and also excited to hear about all the trips and the things you get to do around the house that you are not doing right now. But you'll be missed. Hopefully she's listening right now. But genuinely, you will be beyond missed. I will miss the casual interactions, the laughter, the seriousness with which you take your job, but also the ability to have joy. It will not be the same without.
Thank you.
Well, and I have to say, I've also known Jim now for quite some time. I actually got to meet him when I was serving in my first or second term in the House of Representatives in the state and was working on a radon issue. And we brought that to the committee, and I was very impressed. He is so knowledgeable, and so dedicated. And when I found out that you were retiring, I didn't know what to think. I thought, no, oh no. But now what happens? And then you know what I realized?
That's good.
You have created the most incredible team. And that's because you are a true leader. You know a good leader when they can leave and the team that they have created is so phenomenal that they will be able to carry on. And that's what you've done. You have been a phenomenal leader. I still say it's just not gonna be the same without you, and we'll still have to go to the French press. Those little sandwiches that you just
Still have your
love.
number, so.
Yes. But you have just been so incredibly good for the county, for the state, and even nationally. So be very, very proud of yourself because we all are. And can't wait to hear about all the trips to Hawaii, maybe.
Well,
Have
thank
you
you
been
for all
there?
the garb, but then.
Yeah. No, thank you for doing what you do and putting in place a team that we know we can be so confident in, and it's because of your leadership.
Appreciate that.
Yep.
So much.
And there you have it.
I'd
Does
like to
anybody
say a
else
couple
want-
words. if you don't
Well,
mind.
we might like.
Jim, if
This
I
is
can
your
just
day.
say from Carrie's comments, I think that we're all knowing it.
Yeah.
And that is exactly how I felt when I was like, oh my gosh, he's retired. Okay.
No, I really do thank you for all the comments. You know, just a few things have come to my mind with all of this and all of that. I really am a blessed human being. Number one, I know I have a long life eternally to enjoy, hopefully with many of you. So I'm not counting myself out at this point. I'm blessed too because I have a very supportive wife and family, whom we've gone through a lot together, good and bad, during all these times that I've been spending leading this team and prior. But I have a solid relationship with my family, which helps work a lot. I also am blessed because I've had 50 solid years of employment without a break in income, 50 plus years. That's not easy for a lot of people to say. And that has created a lot of security in my life. And some might say I'm privileged, but I count that as a blessing. And hopefully it's based on the fact that I've worked really hard to do what I've done. I've enjoyed every bit of my career. In fact, when I first started back in Illinois, all I wanted to be was an environmental health professional. I graduated from college with an environmental health degree. That's all I ever wanted to do. And it's taken me and blessed me with a lot of fantastic experiences. Thinking back, you know, not only working my way up the ranks through as an inspector, and then a supervisor, and moving to Summit County to not only start my family and raise them there, but also to start a program that they didn't have, and grow it into something that is still going today. Many of the things that we created back in these days are still going. I've had the privilege of working with oil company executives and government executives and at every level of government. it just the expanse of people that I've worked with, thousands of people. I was kind of going through my contact list, trying to transfer all my contacts to my telephone, and I was like, oh my gosh. I haven't talked to that person in 20 years, but I remember what we did together. You know, I looked through a folder of old papers the other day and saw projects. I've probably forgotten about more things than I've done that I remember. So it's been a blessing to work with so many people, but as was mentioned, this team that I have worked with here, and it's been 60 plus people, 60 plus environmental health specialists since I started here, plus my management team, many of whom are in the room this afternoon, supporting me here. They have taken on this program. They have learned their roles. They are running the show. They are going to build the next legacy of environmental health at Jefferson County Public Health. So I'm hoping I had a little bit to do with that, but I'm sure they're gonna rock it. So thank you all. I really do appreciate the accolades. I'm not much for receiving them usually, but it's good. I'm feeling really good about it. And as far as my future goes, I'm not stepping out of environmental health. I think I've shared with some of you that I am retaining my role in the National Environmental Health Association, so I will be on the board of directors for another year at least, if I decide not to run again. But and there's a lot of opportunities. I guess the biggest thing, the reason why I'm staying involved in that group is because of the dedication to the environmental health workforce. Their mission is to develop and empower a workforce in environmental public health. And being that that's all I've ever done professionally, I want to make sure that it keeps going. So thank you all. That's all I got to say.
Well, we would like the opportunity to have staff speak. If there's any staff that would like to speak, don't be shy.
I can start, but.
I feel like everybody's looking at me. Yeah, I'm just gonna keep it short and sweet. I just want to say thank you. You've been very supportive of my career since I started here as environmental specialist to a senior into that supervisor role, and I don't think I could have done it without you. So yeah, super grateful for you.
And you've
You're guiding.
grown like tremendously in the 7 or 8 years now that you've been with us. 8
Yep.
years.
Yeah.
Yeah.
So thank
Keep it
you.
up. You got a lot of good people behind you.
I do. Another reminder, I'm not gonna go into detail, but retirement party. Make sure you guys are all there.
You clearly see that staff chose just not to follow the directions where why.
And here I'm in this Hawaiian shirt resort wear. On this team.
We were
not
Yeah, but they all got their logo wear on, so.
Yes, that was our backup plan.
Yeah, that's true. That's good. Good job.
Stuff to represent the county in certain situations, so we didn't want to look too casual.
As a good leader would
I'm
be
pretty
like.
casual.
I do have a note from Alyssa. She wasn't able to be online or in person, so I'm just gonna read it to you. In my short time at Jefferson County, Jim has made such a positive impression on my career as an environmental health specialist, but also as a citizen of our county. After meeting with Jim one-on-one during my first week, I immediately felt so positive and proud about the work being done in environmental health in Jefferson County through Jim's leadership. Jim asked what my passion is in environmental health, my why, encouraged growth in my career, and encouraged innovative thinking. This was such a breath of fresh air from leadership, and I will be forever grateful. That's from Melissa.
Thanks.
And Sherry, we do have somebody online, Tracy Volkman would like to say.
Tracy Bulkman, there she is. Tracy.
Hi, Jim. I'm so sorry I wasn't able to get there today. I had mouth surgery yesterday, so I'm recovering. But I just want to thank you for advocating for not only us as a profession of being environmental specialists, but also advocating that we need the help. And when we needed help, you weren't afraid to go in and ask for more positions. I have never experienced, I've worked in 5 different health departments, and typically they had no remorse in cutting staff and say, not gonna, you just have to do more with less. And Jim never did that. He said, we need help. I've got the data to prove it. And he advocated for us. And that will go very much appreciated. He also has been such a leader, both not only locally, but at the state level, as well as the national level. And that is a true leader, looking for opportunity to establish what we need as a profession. And then finally, the policy that you do, you were there and you always stayed abreast of all the things that would affect us from environmental health, whether it was cottage foods, whether it was I don't know, OW, gas, the gas and the gas industry. You've just been a leader at all of that, and I've been very, very privileged to have known him for a long time. And you will be missed, and I hope you are not a stranger to us. So you are
Thanks,
great.
Tracy.
You're great. Thank you.
Thank you, Tracy.
Thank you, Tracy. Yes.
I also want to
so
say
much.
thank you. You.
Stand up though so we can all hear you.
Yeah, I want to say thank you. You taught me a lot, and I've always appreciated your leadership. And I definitely learned a lot from you about environmental health services. Thank you for all the questions that always challenged me in terms of financial statements and all of that. So I really appreciate all that you have done and to help me grow. Thank you.
Thank you for teaching me about accounting. Which I am not the expert.
Maybe that's your next career, accountant. Accounting school. I would like to say something that I shared a lot at the last all staff environmental team meeting, so I'll skip that. But I want to thank you for not taking this job because it gave me the opportunity to be here and to work with you, who changed my mind about whether folks still had the ability to want to learn new things after a certain point in their career. I've worked with a lot of folks who are nearing retirement. And they are like, I'm good. I don't need to try something different. I don't need to be a team player. I can just do my thing. And the way that you have stayed open to new possibilities and trying stuff is so different than any experience I've had before. And we're all better for it. Your team's better for it. The county's better and healthier for it. And I'm so grateful to you for that. You are so much fun too. Like, I will actually miss you being around. I'll miss joking around. I'll miss talking about pizza. I'll miss, like, I'm gonna miss our deep talks where we both start crying. Like, you have been vulnerable and open with me in a way no person at your stage in your career has ever been with me before. And you have renewed my faith in the ability for us all to grow, to be lifelong learners. And so I'm very grateful for that. And again, thank you for not being the executive director. Also, don't worry, I already tried to get him to move to Jeffco 2 blocks over from his house so he could be my boss, and that did not go well. So I was trying to get him on the board for retirement. But
Guarded.
Yeah.
Unless you want to subsidize a house in Bomar for me, that would be.
Absolutely. I can't even get one for myself, Jim.
After they close the streets.
Yeah, close the roads.
I have a van you could live in. It's freshly wrapped if you want.
It's freshly wrapped.
Thank you, Jim.
I just want to say too that I was asked if I wanted to be the executive director, and I said, no, I'm not really qualified to do that. And I think that was probably the smartest thing I ever did. Because what I've seen you do, Sarah, is build a new organization that has a heart for change, that has a heart for imagination, that has a heart to be courageous and curious and all of the things that we want out of this organization. And I think I remember telling you after a board meeting one day, they picked the right person.
Yeah, thanks.
Because they did. And
Wouldn't it be funny though, if we found out that every anonymous complaint I've gotten in the last 3 years was from you? And we find out after the IT does a search.
oh, I just go home and stop my computer.
Yes, so we found out his computer.
All the complaints. I wouldn't wear a Hawaiian shirt for anyone else. You had to drag me into the shirt, so.
And Joe, he had to go to the thrift store.
I got daily reminders, daily, so.
We got you covered.
I have a closet full.
Yeah.
You brought your closet with you.
Why didn't you bring them for us, Jim?
Yeah.
Then we would all been covered.
They had the buttons on the wrong side.
So truly to support Madison's response.
Ouch.
Oh my gosh, Christy, I need to sit still. We really need to have everyone join us next Wednesday evening, at the Golden Mill. I almost said Beer Garden. Golden Mill. We're on the river. We have a whole place reserved just to celebrate you. Tasty treats, snacks, all the things. So please, hopefully everyone online as well as the board can join us for not quite the last hurrah. That's turning in your computer to Brady.
Ready to explode anyway. All right, well, thank you very much, everyone. I really do appreciate the recognition. I'll see you next Wednesday
It will be.
in shorts and flip flops.
And I kind of jumped out of order. Now, is there any other board comments? I mean,
Do we have to approve the resolution? Did we?
Do we have to vote on the resolution?
You can do it quick.
We do, I'm sorry. I didn't think we had to vote on it.
Oh, I thought this is a split.
Okay, well, we have all had a chance to hear the resolution. I would accept a motion to approve the resolution and a second if we have someone that would like to do that.
I will motion to approve that. I'll second.
Okay, all those in favor?
Aye.
Any opposed? Hearing none?
I didn't know there's a favorite part
Resolution.
too.
The resolution is adopted.
The Hawaiian is done terrific.
And with that,
Other.
I think that there's some little goodies.
There are.
Yeah, yeah, to celebrate Jim.
You know.
And with that, no other comments, right? All right.
Yeah. Okay,